If we look at another study titled, quote, low-dose daily aspirin reduces topical minoxidil's efficacy in androgenetic alopecia patients, unquote, by Gorin et al. 2018. This study also supports the same premise, right? NSAIDs reduce the efficacy of minoxidil. So it shows the importance of these prostaglandins as well as their enzymes and how minoxidil kind of uses these prostaglandins as a toolbox to build hair. But again, the full mechanism of action is somewhat of a mystery when it comes to minoxidil. I'll say this, right? If somebody requires an NSAID for, let's say, chronic pain or some pain condition, then using an NSAID that inhibits PGHS2 or COX2, its other name, those particular enzymes, that might be more suitable because it looks like minoxidil just requires PGHS1, also known as COX1, to create those prostaglandins that it will use to grow hair. So the NSAIDs that are used to inhibit PGHS2 or COX2 are meloxicam or celecoxib, and they could be more suitable. But really, again, if you're dealing with pain issues, it's probably better to just use those pain medications when you need it. And if you're chronically using it, that in and of itself has other sort of health implications that you should probably be checked by a doctor for, and really just solving that baseline chronic pain issue. But in any case, even if you are using NSAIDs because you have to and you still want to keep your head of hair, and you don't want to disrupt the efficacy of the minoxidil that you're using, right? There are some potential solutions. Because since it seemingly is the case that minoxidil uses PGE2 and PGF2 as tools to grow hair, using topical minoxidil with a PGF2 alpha or PGE2 analog of some kind like latanoprost, bimatoprost, or travoprost could theoretically enhance minoxidil's efficacy even if NSAIDs are used. Because you are artificially adding those prostaglandin analogs, you don't have to wait for the enzyme PGHS1 or COX1 or PGHS2 or COX2 to create those prostaglandin analogs. And this can also help somebody who may not be responding well topically and even orally to minoxidil's use. Let's say you're using oral minoxidil and you're not getting the best response on your scalp. Maybe you can use latanoprost, bimatoprost, or travoprost to theoretically increase those prostaglandins locally so minoxidil can actually make use of it. But if we're going to go down this route anyway, let's examine other avenues where there might be a bottleneck on minoxidil's efficacy. So another factor in preventing minoxidil from working effectively could be minoxidil sulfation. So minoxidil sulfate is a prodrug of minoxidil, but it is the key driver of hair growth in human hair follicles. The study titled, quote, Minoxidil sulfotransferase, a marker of human keratinocyte differentiation, unquote, by Garland A. Johnson et al. 1992, shows us how the enzyme sulfotransferase needs to be reasonably abundant to convert minoxidil to its active form, minoxidil sulfate. And to get an understanding of minoxidil sulfate a bit more, we can even look at a case report series titled, quote, Systemic Minoxidil Accidental Exposure in a Pediatric Population, a case series study of cutaneous and systemic side effects, unquote. And this is by Manuel Sanchez Diaz et al., published in 2021 in the Journal of Clinical Medicine. So essentially we have a case series where children have accidentally orally consumed minoxidil. The authors go over some of the side effects being low blood pressure and also hypertrichosis, but they link that to the result of minoxidil sulfate's action. So minoxidil has to be converted into minoxidil sulfate in order to have these sort of effects. Now, interestingly enough, it also mentioned prostaglandin E2 or PGE2 production. The authors state that, quote, at the biochemical level, minoxidil is able to induce several changes in the expression of different molecules. Minoxidil increases vascular endothelial growth factor, also known as VEGF, levels, hypoxia-inducible factor 1 alpha, and prostaglandin E2 production. These biochemical changes may modify the microenvironment of the hair follicle, including a prolonged anagen phase and increased hair growth. It is thought that the action of minoxidil on hair growth is mainly due to minoxidil sulfate, a metabolite of minoxidil. The enzyme responsible for its generation is sulfotransferase, which is located in hair follicles. End of quote. Essentially, The authors go on to talk about how the genes that control for sulfotransferase enzymatic activity varies between one person to another, so this is what gives the varied response of minoxidil and minoxidil sulfate at that its sort of efficacy. But ultimately, at the end of the day, it can influence PGE2 along with impacting potassium channels. All of this together can sort of cause hair growth effects, but also reduce blood pressure. So, what are other ways to increase sulfotransferase enzymatic activity? So, if we were to use prostaglandin analogs like latanoprost, bimatoprost, or travoprost, is there another way outside of using minoxidil sulfate to grow hair? Because minoxidil sulfate is very unstable in an aqueous solution, so it's going to be hard to kind of deliver that to the hair follicle. Well, we have some small studies that indicate that retinoids such as tretinoin and even potentially adapaline and even tazarotene, and these may stimulate sulfotransferase levels and may be used to enhance minoxidil's conversion to minoxidil sulfate, as suggested by studies like, quote, efficacy of 5% minoxidil versus combined 5% minoxidil and 0.01% tretinoin for male pattern hair loss, a randomized double-blind comparative clinical trial, unquote, by Shin et al. 2007, and the paper titled, quote, promotive effect of minoxidil combined with all trans-retinoic acid, tretinoin, on human hair growth in vitro, unquote, by Kwon et al. 2007. Now, if I had to sort of give a marker on the effective concentrations, I would say probably for tretinoin, the higher you can get, or the closer rather you can get to 0.1%, right? The closer you can get to that, that being the maximal amount, the better sulfotransferase enzymatic activity you will have. Likewise, with adapalene between 1 to 3%, I wouldn't really go above that, just personally speaking. And tazarotene, this is pretty strong. I would probably just stay at the 0.1% concentration. But moving back to the whole minoxidil sulfate kind of thing, you can either use a liposomal option or a lipid delivery system for minoxidil sulfate that could be useful here, as demonstrated by Dr. Trueb in the paper titled, quote, efficacy, tolerability, and superiority of propylene glycol-free North American witch hazel based solution of 5% minoxidil sulfate for the treatment of female androgenetic alopecia, unquote. And in this particular paper, we have women who weren't responding to both topical and oral minoxidil, and after using this, it seemed to have helped.